privilege and an honor to be able to serve next to like people in our own country.
Tonight, a WRTV exclusive. A month after the Biden administration deployed a 20-person U.S. Navy team to help IU Methodist Hospital, our Nikki DeMentri sits down with that team and hospital leaders. They are sharing their experiences working together as hospitalizations continue to surge across the state.
It is like a movie. It's much like a movie.
Christmas week, a U.S. Navy team of 20 deployed to IU Methodist Hospital.
This is our second mission. Our first was to Wenatchee, Washington, where we spent about 30 days out there helping one of the regional hospitals.
Lieutenant Commander Michael Gibney is the officer in charge of the medical team. He focuses on administrative roles, highlighting in December the team
And integrate in the course of 2 or 3 days and be fully invested in this hospital.
Lieutenant Megan Best is assisting as a staff nurse on a medical surgical unit. She's working 12-hour shifts side by side, Methodist nurses, doctors, and the like.
It's no more like, oh, you're just going in to take care, patients. You're going to take care of patients that are really sick.
Since starting, COVID-19 cases and hospitalizations across the state hit new records. Staffing and resource shortages continue to add to the problem. On Friday, 158 of IU Health's 589 system-wide COVID-positive patients were at Methodist.
We are still at the point where when any bed does open, it becomes immediately filled by another patient.
Busy inside these hospital walls is an understatement. But even so, Lieutenant Best notes the patients are grateful.
It makes it very rewarding when your patient's like, I know y'all busy. I hear it out there. I hear it. They hear what we're going through.
Lieutenant Commander Gibney adds the team is proud to be assisting at Methodist.
To know that we're doing something so much bigger than each of us individually is a great feeling and a great accomplishment.
It's a mutual feeling for Dr. Luchtenmeyer and IU Health.
When you talk about the value of team, this team has really embodied those values and have been a great support and help.
The chief medical officer who oversees Methodist says it's unclear when peak will hit, but the hospital is prepared for what may come through its doors over the next few weeks, and the U.S. Navy team plays a big part in that.
It's a privilege and an honor to be able to serve next to people in our own country.
Working for you, Nikki DeMentri, WRTV.
Well, for 2 years, we've been talking about the impact of COVID on hospital capacity. Of course, that's on top of the patients who are in the hospital for other reasons. We're taking a closer look at how the number of COVID patients compares to other patients. IU Health runs both Methodist and University hospitals in downtown Indianapolis. Combined, they have a total of 207 COVID patients right now out of 800 total patients. That means COVID patients make up about a quarter of all patients being treated by IU Health's Methodist and University hospitals right now.